Your PNN news for May 2025 by Giri Srinivasan, registered physiotherapist. This news broadcast is brought to you by Synaptic Integrated Health Group, operating 13 multidisciplinary physio clinics across Edmonton. We are going to start with rehab research insights. Number 1 insight: MRI for meniscal injuries. Meniscal tears are common in young adults, but recent research shows that early surgery is not always necessary. So, what makes the difference? MRI findings. A new study found that if the MRI shows effusion, which means swelling, or synovitis, patients respond better to surgery. But here's the twist: it depends on the type and location of the tear. Whether it is simple or complex, or inner side or outer side, they do not predict better outcomes. So, clinicians, before rushing to the OR, consider what the MRI says about inflammation. That is our first research. The second research review we're going to discuss today is postpartum exercise and pelvic health. During the postpartum year, people are at increased risk of urinary and anal incontinence, diastasis recti, which is the splitting of the abdomen, and also pelvic organ prolapse. Research shows that pelvic floor exercises help reduce the odds of incontinence, while abdominal exercises reduce diastasis recti. So the takeaway point here is early postpartum rehab matters. Let's guide new moms with evidence-based support, not just online advice. That's our 2 research reviews for our PNN news. Next, we are jumping on to 1 clinical practice guidelines. We are going to discuss about how we should treat ankle sprains now. Out with the old, in with the evidence. We are rethinking the traditional R.I.C.E approach. My good colleague Kevin Dale recommends a new standard: ice less because inflammation supports healing, elevate less because early walking boosts proprioception and the healing, and also wait less. Start rehab early once serious injuries are ruled out. Some pain is okay, movement is medicine. Let's not delay it. That's the clinical practice guideline from PNN. Next, we're going to talk about 1 effective exercise. It's rolling. What is rolling? It's not the foam roller rolling we are talking about. The rolling you did when you were 6 months old, lying on your back and rolling onto your tummy, and lying on your tummy and rolling onto your back. That's the kind of rolling. And why it is very important exercise? Because rolling activates the same muscles you use for your walking. Go slow when you roll, focus on breathing, do it nice and slow, not too rapidly. So that's the exercise part of PNN news. And next coming up is the recent innovation. NeuroCatch. This is not a science fiction. It's a point-of-care brain function testing in 6 minutes. NeuroCatch measures brain vital signs using EEG signals to evaluate cognitive processing, speed, memory, and attention. Once we set up everything, it will only take like 10 minutes to finish the test. And Insta Physical Therapy in Edmonton has that NeuroCatch. I think we are the only one who has it in Edmonton. It's very fast, non-invasive, and repeatable. It's very ideal for concussion rehab, post-COVID fog, and neuro screening. It's good for everyone, and also for athletes to improve their cognitive performance. It's clinical neuroscience made accessible to you. So, if you need more information, go to neurocatch.com and check it out. Next in PNN coming up, your Mythbuster. Deep squats are bad for your knees. False statement. If you have healthy knees and good form, deep squats are completely safe and even beneficial. They improve hip mobility, quad strength, and joint stability. Let's stop fearing functional movement done right. Next in PNN coming up is success story. I'm going to share a success story of one of our patients. Miss T came to us with the diagnosis of functional neurological disorder. It's a very common condition nowadays. After COVID, we are seeing much more patients with the FND diagnosis. So, Miss T came to us battling functional neurological disorder with our multidisciplinary care, physiotherapists, occupational therapists, psychologists, kinesiologists. We put together a nice neuro rehab program for her. It's called FND Integrated Program. With her unwavering resilience, she progressed from falling, buckling gait to independent walking in about 2.5 months. Now she's back to her dance, to her school. Parents are happy, she's happy. Her story is a testament to neuroplasticity and the human spirit. Miss T your journey inspires us all. If you're diagnosed with FND, don't think you have it for life. There is a light at the end of the tunnel. You can reach out to your neuro rehabilitation provider to get help for that. This wraps up Physio News Network, the first episode of Main News, where we turn evidence into action. I am Giri Srinivasan, physiotherapist. See you next time at PNN. Bye.